People with low T or low testosterone are real prone to depression and anxiety. You see, testosterone is the master neurotransmitter booster. It boosts all the major neurotransmitters. It boosts the dopamine, which makes you feel good. It boosts norepinephrine that gives you energy.
Hey, Kyle Colbert here, and this is Dr. Colbert's broadcast. I'm here with my dad, Don, and my mom, Mary. That's kind of weird saying dad, Don, but my dad, Dr. Colbert, my mom, Mary, and we are talking about your number. Do you know your number? The last number was prostate.
Right. That's a real important number. Now, this one's equally as important. And for men and women, do you know your total testosterone level? Yes, women need testosterone. In fact, testosterone is more important than estrogen if you're over 50.
Even for women.
For women, yes. Real important. I'm going to talk about what that is for women.
Now I'm getting ready to get my pellets tomorrow.
Yeah, she gets her testosterone pellet. Yeah, about every 4 months.
Well, we know you've been working on your testosterone. My joke for you is you can get a room full of men, and when my mom walks in, she's got more testosterone than all of them together.
She does. She does, because men's testosterones are tanking.
That's the problem.
And their estrogens are increasing in the country.
Heard that. Is it true that 200 years ago, men's testosterone is
not 200?
That?
No, it's about in the back during the around 1940s, World War II era.
Just in the last
a normal testosterone back around World War II, according to old lab manuals, was as high as 2,500.
2,500 normal.
Yes. And that's why those were the supermen in World War II that won World War II.
Against the Germans.
Against the Germans. Our men were supermen.
That
had levels of 2,500.
And this wasn't artificial. This is all natural.
No, it was natural. They were taking.
You know, the Germans took all the methamphetamines for their. So they are troops in Germany.
Took testosterone. Yep. These are supermen in America.
It explains why we have men wearing skirts.
But no, let's find. The reason why we're seeing such a drop in testosterone levels in this country is very simple. Number one, the more belly fat you have, that increases aromatase activity, and aromatase converts testosterone to estrogen. Also, we are literally bombarded with all these chemicals, these hormone disrupting chemicals that raise estrogen levels. And then our diet is such that we eat a lot of sugars and carbohydrates, and that literally causes increased aromatase activity that increases estrogen. And then marijuana is being legalized in many states. Marijuana smoke increases estrogen.
Interesting.
But then another thing that's so important, people that are obese generally have lower testosterone levels. People with liver conditions, fatty liver, are more prone, or kidney problems, or more prone to low testosterone levels. Certain meds will lower testosterone, like antidepressants, SSRIs, Lexapro, Paxil, Zoloft, lower testosterone. SNRIs, Effexor, Prestige, Cymbalta, lowers testosterone. Tranquilizers lower testosterone levels, like Seroquel, Haldol, Zyprexa. These lower testosterone levels. Narcotics do. They lower testosterone levels, and tramadol, even though it's a synthetic narcotic, it lowers testosterone for chronic pain. So we have all of the diabetes lowers testosterone, obesity lowers testosterone. There's things that lower alcohol. Heavy alcohol consumption or regular alcohol consumption lowers testosterone. Well, you know, a person that drinks a lot of alcohol has a big belly. They're increasing aromatase enzyme. They're boosting their estrogen. They're lowering their testosterone. That's how it works. And so we have a lot of things doing it. Another thing that's common is sleep apnea. Oh my goodness, sleep apnea is epidemic in this country. I diagnose it almost every day in my practice. And sleep apnea causes low testosterone in men, because to have testosterone, you have to have that deep sleep and REM sleep balanced. When you don't have it, it lowers your testosterone. So all of these factors lower testosterone, but then other key things that do it are anabolic steroid use, testosterone use. A lot of doctors are putting men on high-dose testosterone that are setting them up for prostate cancer, and that when they go off of it, they have no testosterone. And also other things.
Does it turn off your natural production?
Yes, it does. Unless you use HCG, but that will stimulate your own production. And then also inflammation, a sexually transmitted disease creates inflammation in your testes that lowers testosterone levels, as well as mumps will lower testosterone levels if a person gets mumps, as well as chemotherapy. Radiation therapy can lower testosterone.
What about all the radiation just in general? Can that lower testosterone? Just being
Absolutely,
exposed
sure.
to Wi-Fi, men's Wi-Fi in the pocket.
Absolutely. If you have your phone in your pocket, absolutely it can affect your
And they have
testosterone.
studies, clinical studies.
Well, these are new things coming out with
Okay.
these 5G. Yeah, it can put more stress potentially there.
Interesting.
The studies are coming out on that. They're looked to be it can lower testosterone levels. But the biggest thing is aging men. Men, if you're over 50, your testosterone is gradually going down. More so if you have more belly fat, sleep apnea, more disease, more fatty liver. If you're on more medicine, it's literally tanking your testosterone. Your testosterone is the key to being a man. And so other things that do it are these endocrine disruptors. One of the biggest endocrine disruptors are just phthalates. Phthalates are found in personal care products. 75% of personal care products, shampoos, conditioners, body washes, lotions, deodorants, they have phthalates in them that interfere with testosterone.
And phthalates are
Plasticizing chemicals that we put in 75% of our personal care products contain them. That's why you must look for labels that say phthalate, PHTHLATE free. And that way it doesn't contain phthalates. These are plasticizers that lower your
and
testosterone.
phthalates just give the bottle just a nice smooth kind of finish. Isn't that right?
No, these are chemicals actually in the shampoo.
The
It's the plastic
ingredients
in the
are-
bottle, but it's also in the shampoo liquid that you're putting on your hair, body wash that you're putting on, colognes full of phthalates. It gives a fragrance.
What about the inner lining of cans, like cans?
Well, that's bisphenol A.
Okay.
Now, again, only 10% of canned goods now have bisphenol A. It's an epoxy resin, and so they've diminished it, but still it can have some. So now they say as low as 10% of metal cans have bisphenol A in it. So it's really come down. So it's still better to
That's
choose
good.
glass or stainless steel, still best. But you're right, bisphenol A contains it. Pesticides do. The most common pesticide sprayed in homes is called chlorpyrifos, which is used for termite control and pest control. And what this does is it lowers your testosterone levels. So if you're having your house sprayed with this, and especially in
Inside.
pesticide work,
Mainly.
inside your house, and if you get this on you, you're more prone to have lower testosterone levels.
Now, Don, we need testosterone
Yeah,
to live
we do.
long and strong. So
You need to.
we've
Men
got
and
to-
women.
men and women.
Yeah.
So this is affecting both of us.
Exactly.
And so it's really, really important
Right.
that people know that this is a major part of
Right.
living long and living
Right.
strong.
But we want to talk about the symptoms because so many people are going to their doctors for these symptoms, yet it's just their testosterone's in the tank.
Oh,
As we're going to talk about this.
tell the people.
But
tell
first,
people.
there's one other thing that causes low testosterone. They're these forever chemicals, PFAS chemicals or forever chemicals. We did a show on this real quick. It's in about 45% of our tap water. So if you're drinking tap water regularly, you're getting these forever chemicals. It's also commonly in microwave popcorn bags. It's in pizza boxes, fast food wrappers, paper coffee cups coated with water-resistant coatings. When you go to Starbucks and you get that cup, that's got those forever chemicals in it.
And you think you're being healthier because you're not choosing the styrofoam cup.
Right, exactly.
But even in the paper cup, it has the lining on the inside.
That's why if I ever go to a coffee place, I get the glass mug. Okay. These are the symptoms of low testosterone. You ready? One of the most common things we see with men and women with low testosterone is fatigue. These people are not just tired, they are exhausted, bone tired.
Bone tired.
They are so tired when they get 8 hours sleep, they're still exhausted. And it's usually low T. Remember, people with sleep apnea are much more prone to develop low T, and sleep apnea is absolutely in epidemic proportions now.
Well, what age kicks in for this fatigue? Because it's not at like a 25-year-old.
We're seeing low
fatigue.
testosterone, Kyle, in their 40s and 50s.
Okay.
45% of people have low T that are over 45 or over.
Okay, so almost half
So,
the population are
almost
the age of
half,
45.
exactly. Almost
Wow,
half that's a lot.
that is a lot of people.
And so, with more diseases, with more obesity, alcoholism, with fatty liver, with sleep apnea, medications you take, it just exponentially lowers that testosterone level. So, when some people come to see me, I check their levels on all men, and I commonly see testosterone's in the low 200s, some in the low 100s, and they're wondering why they're so exhausted. I said,
Men 80 years ago were at 2,000?
yeah, 2000.
And you're
500.
Yeah.
so they're not even 10%.
Yeah,
And man, their ancestors were.
stress, not
My
stress, lower
That's scary.
testosterone level.
Yeah, so
Scary.
Another major trigger of low testosterone is stress. The more stress you're under, generally, the lower your testosterone.
we have a society of stress.
And our people are stressed out. The higher your sugar is, generally, the lower the testosterone. The more belly fat, the lower the testosterone. You see how
It's a
it
cycle.
compounds exponentially.
But you remove God from the school systems and you remove God from everything, and
Oh,
you're not able to. Yeah, you forget
you-
to cast your cares on
Exactly
Him.
right. So
Live it stress-free.
here are the symptoms
Exactly.
of low T: fatigue, reduced libido, decreased strength and stamina. Not only strength, but stamina decreases significantly. This is a major one: loss of armpit and pubic hair. Guys come to see me and they say, "Look, I don't have any hair under my armpits." And they say, people think I shave. And I said, that's your testosterone being low. Testosterone creates armpit hair and pubic hair. So when you see that, that's your sign that your testosterone is low. Increased body fat. When your testosterone is low, your belly fat generally increases, and increased belly fat triggers lower testosterone. See how it works? They
And
work off-
increases estrogen.
and increases estrogen, correct. Also, when your testosterone is low, you generally have lower bone density. The greatest driver of bone density is testosterone for men and women. And of course, vitamin D and some other key things, but testosterone keeps those bones strong and prevents fractures
Is that
for
one of
men
the
and women.
primary reasons it's important to keep testosterone high in women?
Absolutely, because a lot of women I see have osteopenia or osteoporosis. One of the first things I do, I increase their calcium, their vitamin D, their K2, and also put them on testosterone.
Interesting.
And
I had a
testosterone,
yard guy. I had a yard guy that is in his 20s, and he was out, not in my yard, but I mean, he comes and does my yard, but he was out doing a lawn somewhere, doing whatever he was doing, and then all of a sudden he collapsed. His leg fractured for no reason,
wow.
just snapped, and he had to have a rod put in his leg, and it's because his testosterone's like 100.
You're kidding.
No,
That sounds
his
like a bone disease.
no, his bones have just become so brittle, and
Yeah,
he's
they
in his
do.
20s.
That's
Wow.
crazy. That's what we're seeing.
Well, we heard how many things drive testosterone down.
Oh, yeah.
It seems like you can't get away from it.
Like-
How do you get away from it?
Well,
What do you
we're going to show them what to do. We got the keys in just a minute. Let me continue. These are the symptoms, though. If you're having these symptoms, please get your total testosterone level checked. We're going to tell you the levels you need for both men and women. I do this for every patient I see. Other symptoms include problems concentrating, poor memory. Testosterone increases that brain-derived neurotrophic factor that's like miracle grow for the brain. It restores those neurons in the hippocampus, which is the short-term memory center, and in the prefrontal cortex, which is the long-term memory center. So it's critical for the brain, as well as people fall asleep easily. People with low T at night after work or shortly after work, they'll sit down on the couch and fall asleep. They'll turn on the news, they'll fall asleep. They fall asleep easily. That's another sign. This is the biggest sign for men and women. Men are grumpy and women are irritable, but it's a whole new level of grumpiness and irritability.
know?
We call it the grumpy old man syndrome or irritable old woman syndrome.
Oh no.
So that's what happens, the grumpies and the irritabilities, right, Mary?
Right, and what we'll do with couples is we make sure that when they come in, both of them get their labs done. So Don will optimize both of
Absolutely.
them
If we don't,
because
we
he
got
doesn't want to
marriage
cause divorce.
Couples who get their hormones checked together stay together.
Go.
optimize together, we'll stay together, yes.
That's a good
And then
thing.
other symptoms are night sweats and hot flashes for men and women. When the testosterone's low, they get these hot flashes, night sweats. A lot of men
I've
come in.
been having those lately.
That's
for
a
the past
sign.
6 months.
Your
At night,
your
and I'll just get overwhelmed
Right.
with this heat.
Have you had your labs
I have
done?
not. I'm listening to some of these side effects going, that is me right there.
People with low T or low testosterone are real prone to depression and anxiety. You see, testosterone is the master neurotransmitter booster. It boosts all the major neurotransmitters. It boosts the dopamine, which makes you feel good. It boosts norepinephrine that gives you energy, and it increases serotonin that makes you satisfied, not wanting ice cream and cake and starches every night and
And
sugars every night.
testosterone helps produce all of those hormone
Yeah,
levels.
those neurotransmitters.
Neurotransmitters.
Exactly. It also, if your testosterone is low, you'll have sleep disturbances. You won't sleep good. Now, men's testosterone begin to gradually decline at age 30 to 40. 30 to 40, that's young, and they decrease at a rate of 1 to 2% per year.
Wow.
So that's why you just do the math and you see some men are doing it faster because they're drinking alcohol or they have sleep apnea or they're eating the wrong foods that are increasing estrogen and lowering their testosterone. Now, health benefits of optimizing testosterone. Now, when you optimize testosterone, this is what happens. You gain muscle mass and strength and you maintain it. You maintain your bone density and your bones get thicker. And especially if you're exercising, I put all my women with and men with osteoporosis, osteopenia on a weight-bearing exercise like leg presses. And so it helps those with osteopenia or osteoporosis in their hips. And so it's really important to do that, different exercises that I
Remember, we used to do what are called sarcopenia workouts.
Oh, yeah.
Remember that?
Okay, I remember those.
Testosterone?
Exactly.
Squats.
Okay, also testosterone contributes to a healthy metabolic rate. People start to burn fat because your muscles is your metabolic energy bank account. And the higher your muscle mass, the more calories you're burning at rest. It heats you up. The more muscle you carry, the higher your metabolic rate generally is. When you're burning muscle, you're also extinguishing your metabolic rate or you're lowering your metabolic rate. Testosterone can improve mood and reduce depression and anxiety. It promotes energy and vitality. It can support memory and focus along with mental clarity. It helps maintain a healthy libido. And when you bring it to testosterone to healthy levels, you have a lower risk of cardiovascular events, according to the Traverse study. And it did not increase the risk of major adverse cardiovascular effects. A lot of people say, if I take testosterone, I'll increase my risk of heart attacks and stroke. Not so, according to the Traverse study. But again, they didn't do like bodybuilders do. They didn't put them on super high doses that can cause cardiovascular side effects. You want to have it in a range, and we'll talk about the range in just a minute. And then it helps to improve, for many, it improves sleep. It also helps some with pain control, especially those with inflammation in patients with arthritis. Now, for women, it does the exact same thing. And like I say, for many of my patients, once a woman gets in their 50s, sometimes in their 40s, I'll start them on testosterone, either a cream or a pellet or occasionally a shot. The cream's the easiest for my women. I get their testosterone level up to 70 to 125, sometimes under 50. If they're losing bone, I may take their testosterone level up to 200. You say, well, they're going to grow, they're going to lose hair. No, they don't, because I put them on, I put them on something to block that dihydrotestosterone, a supplement, either pumpkin seed oil or a little finasteride to block that so they don't lose hair. But again, that's the level. Why? Because a healthy 20 to 25-year-old lady generally has a testosterone around 20 to 70. And I find if we can at least get them to 70, then that'll serve them protection against bone loss, especially. So that's a good, and it gives them lots
And it
of
actually
energy.
helps with prevention of breast cancer, doesn't it?
Exactly right. And so again, that's one of the key things. Studies have shown, suggest that testosterone may offer, this is real important, protective effect against breast cancer by acting as an anti-proliferative agent and promoting cell death in breast tissue, which counteracts the cancer-promoting effects of estrogen. Isn't that amazing? So we find that testosterone can actually protect women against breast cancer.
And it sounds like it attacks the cancer.
Yeah, it has that protective anti-proliferative effect, which is amazing. So again, we don't jack that testosterone up too high. We start low and then we monitor them. I monitor my women yearly with mammograms.
And what's the downside of taking too much testosterone as a woman?
Well, again, you can lose hair. It can actually
They can actually grow hair.
it can aromatize to estrogen. So you got to be careful and not to give too much. But usually, once we get them in that
So it's a
range,
sweet spot.
it's a sweet spot. We get them usually about 70 to 125, occasionally 150. If they're got osteoporosis, we may boost it to 200. Which
And it
rarely
does
seems
work with
problem.
a woman's libido too.
It definitely
actually
boosts their
helps.
libido.
Oh, I bet it drives it.
It
It
does.
does.
It does.
Now, we give testosterone creams and we give injections and pellets. The best by far are the pellets.
Is that just because they act quicker?
Well, the pellets work similar to the way the body God designed our body. It slowly releases the testosterone, and it releases it with cardiac output. So when you're on the treadmill or the stair
Lift-
climber or
That's
elliptical
what I do. I do the pellet, and I
Yeah.
can see a huge difference.
So it releases more when you're needing it more. And it
exactly
restricts
right.
it when,
Right.
okay, because it's in the fatty tissue. So it's pulling from it, or is it based on
Well, yeah, it's in the fat, and the more your body increasing circulation, it releases more of the pellet.
Interesting.
So some women
That-
go through. I have a lady that was a marathoner, and she'd go through pellets every 6 to 8 weeks.
Oh, wow.
But she felt amazing.
You
She
can
was strong,
metabolize it quicker.
and she lifted more on leg presses than her husband. Her husband got a little bit. He was on pass too, but she was something else. She was one
Wow.
of those workout people. But again, also what it does is it strengthens the heart. Testosterone's wonderful for the heart. And for women, it helps many with urinary incontinence. As a woman ages, they start to get bladder incontinence and they lose their urine when they cough or sneeze. Well, that testosterone, along with Kegel exercises, can strengthen those muscles and prevent pelvic relaxation, where everything kind of drops and then they're urinating all the time, or when they cough or sneeze, they're losing their urine. Testosterone many times helps that in a lot of my women. Now, again, we can use it in creams. Some women put it behind their knees. Some women put it in their vaginal area, or the pellets, my favorite, or we can give a little shot once a week. So there's many ways to do it.
Okay.
And so those are the main ways to
And
do
for
it.
men too.
And for men too, do the same thing. And now the numbers. Here's your numbers. The American Urology Association concludes that blood testosterone levels less than 300 nanograms per deciliter for males is low. And they recommend levels of 300 to 1,000. I optimize those levels 500 to 1,000. If you're over 60, they recommend keeping your level between 300 and 750.
Well, what would happen if
So-
we get our levels back to those, and our ancestors were from 1940 that went to war?
Again, we have to protect the prostate because a lot of testosterone, remember, can cause high DHT levels, dihydrotestosterone, which fuels prostate cancer, makes the prostate grow. You don't want your prostate the size of an orange or a grapefruit and have to go to the bathroom every hour like a lot of guys. I've seen bodybuilders in the past. They abuse it. They have their testosterone levels at 2,000, 2,500, and their prostate grows. They have a big prostate that has to be reamed out. Most guys don't want that, or they can be more prone to develop prostate cancer. So that's the
I didn't even know you
downside
could
to it.
wring out your prostate.
Well, it's called, TURP, a transurethral prostate resection, where they go in when the prostate should be the size of a walnut or a ping pong ball, and it's about 20 to 25 grams. When your prostate's double or triple that, say the size of an orange, the gold standard to shrink it, now they're using embolization, it's something new. But what they do is they go in, it's called a transurethral prostatic resection, where they go through the penis and they chip it off. And so they literally chip it to the size of a small prostate. But that just will cause problems.
Chip it like peeling an orange.
Like peeling little pieces off. They use a laser that just piecemealed it off.
It's just
Okay.
thinking about it.
Okay, now the normal levels for men that are age 60 and over should be between typically 300 and 750 nanograms per deciliter, but I optimize that I keep mine around 500 to 750. And that way you don't get into cardiovascular side effects. Men that are over 60 are more prone to heart attacks and strokes and enlarged prostate. So we don't want to boost it up to 1500, 2000. That's too high. And so we dial it back. We usually put our men's testosterone dose to around 0.3 mLs to 0.4 mLs once a week injection, something like that. Okay, so now again, the key thing is realizing what your numbers are. Women, we want to have your numbers of testosterone. So many women come in to see me, their numbers are in the tank. They have maybe 5 or 10 or 15. That is extremely low. We try and get your numbers up to 70 to 125 or 150. And then let my women have the energy, they have the mental clarity. It helps with those neurotransmitters. They're able to sleep well. It turns off hot flashes, night sweats. The big thing is that fatigue. People are so tired that and they're so grumpy and irritable, when they sit down, they just fall asleep. And the spouses just let them sleep so they're not so grumpy. Okay. But when you start this process, it brings it up. Now, if you're less than 50, we don't use testosterone. We use a natural supplement called testosterone zone. The testosterone zone contains natural herbs like Testofen, which is a standardized fenugreek that boosts testosterone levels. It also contains tongkat ali, that is a natural herb that boosts testosterone, and some key vitamins and minerals. And you take 3 a day.
And men and women can take this.
Yes, and it boosts it. It boosts testosterone levels. I see many of my men, and their testosterone was low. I put them on this, and their testosterone is normal.
What's the dosage on this?
3 a day in the morning,
That's it?
usually.
That's it?
Don't
Empty
take
stomach?
3 at night. It doesn't have, can be it's on an empty stomach or with food, but it definitely helps to boost testosterone levels. It used to be in a powder. And so I had one guy just a month ago. He used, I was on a nationwide podcast with Steve Bannon year
Oh, yeah,
ago.
with Steve Bannon.
And he's been on it for years. He said, you ran out of the powder, the testosterone zone powder. He says, that stuff worked amazing. His level went sky high. He says, I said, now I have the capsule. It works just as good. And some men need, instead of 3, they need 4. That's the only difference.
Anything you can eat to raise natural testosterone that helps?
Well, again, no, it doesn't
There's
really
no-
help.
okay.
No, the key thing,
So you need a supplement.
you're going
Okay.
to need a supplement,
right.
and you've got to keep that sugar down. Follow the you've got to follow the Beyond Keto diet. Really important, because
And we have a book.
that keeps your estrogen down and helps raise your
Okay, we have a
testosterone.
book real quick.
Yes,
The
the hormone
Hormone
zone.
Zone. It goes into detail. You want to get a hold of this book. He covers everything in detail and numbers and blood tests. So be
Right.
sure and get it.
Dad, this has been great. What a fascinating show. We need to keep our testosterone high. Make sure, in order to get your energy back,
Or not high, but balanced.
balance.
Optimize.
Okay, let's optimize it. Let's optimize it together. I'm going to get mine checked. You get your check. Testosterone Zone, you can get this at divinehealth.com, as well as Dr. Colbert's Hormone Health Zone. Next show, we are going to talk about something that's going to help you lose weight and burn fat. It's your thyroid. Stay tuned. We'll see you on the next show.